Well, I think that we are all extremely concerned about the update. Essentially, what the CDC is now saying is that there is a possible link between vaccination and autism, and that is false. The data that they're using to make that assertion is based on information that we know has been debunked. It's not true, and that it has actually been revoked from prominent medical journals. We know that there are many studies that have shown that there is no link between vaccination and autism. I think that it's very concerning that this is now on a government website and that people may continue to turn to the CDC for vaccine related information.
Do you think, that can create some confusion or fear among, families?
Absolutely. I think that there have always been people who are anti-vaxxers, but even prior to this post on this government website, on the CDC's website, there's been an increase in rhetoric that increases people's concerns, hesitation around using vaccines, getting a vaccine, and a lot of questions around vaccine efficacy and safety. So really the concern preceded the website, but the website ups the ante a bit on what it is that our government is saying about vaccination. And I think a lot of people still trust government websites, and that is very concerning to me, both as a healthcare provider and as a public health leader here in Boston. I think that what is going to happen is that there are fewer people who are going to want to be vaccinated because they may not know that there is, there is a problem, but they've heard things. And I think when people hear things, that becomes worrisome and people would just rather avoid vaccination entirely. So it is concerning. It is something that I've seen in my patients. And we want to make sure at the Boston Public Health Commission that people have accurate information so that they can make really critical decisions about the health of themselves and of their families.
And now, to end this short conversation, what steps will the Boston Public Health Commission take to counter the impact of this misleading information?
Well, our goal is to counter the impact of both the website and the anti-vax sentiment that has been increasing in our country by providing the most accurate and reliable information possible about vaccination and to be a trusted source for information, a trusted source not only for information regarding vaccines, but for the vaccines themselves. We have gone really above and beyond, particularly this year, to be visible in social media, to be visible on the ground, partnering with community-based organizations, particularly in communities that may not have access to, information that's, health related all the time. Certainly partnering with IFC and other organizations in Mattapan. We have held vaccine clinics throughout our city, and we've actually distributed more than 2,400 vaccines to Bostonians thus far this year, which is much higher than we've done in previous years. So we've been not only visible online, but certainly visible on the ground, as I said, in person, in communities. And we want people to trust us as an organization that is focused in on health and wellness and believes in science and trust the science that's out there that is very clear about the fact that vaccines do not cause autism. So those are the steps that we're taking. We will continue to be a reliable source. We will continue to be available online as well as in person, and then we'll continue to have our vaccine clinics available for residents.
Thank you, Dr. Ojikutu, for your time.
Okay, thank you.
Breast cancer affects millions of women in the United States as the second leading cause of cancer-related deaths. Black women are especially at risk of developing and dying from breast cancer compared to women of other races. Early detection can improve treatment outcomes and save lives. Mammograms are a powerful tool in the detection and fight against breast cancer. A mammogram is a quick X-ray that can identify abnormalities in the breasts long before they can be physically felt. Every woman aged 40 years and older is entitled to a free mammogram under the Affordable Care Act every year. Make mammograms a priority in your healthcare routine. It's a small step that can have a huge impact on your health. Let's work together to empower women.